So patients ask, what type of hormones do I prescribe? What's interesting is, what I learned in medical school is not what I do now. That wasn't research based. What I do now is research based. The first hormone I'll talk about is estradiol for men and women. I give it to men for three reasons: prostate cancer, to prevent heart disease or remove plaque from the vessels, and for BPH. So the oral estradiol is the only way to get rid of plaque in our vessel walls very safely. Premarin did it risky: stroke, heart attack, blood clot. Nothing like that happens with estradiol ever, not in research, not in my practice. But it turns on an enzyme that gets rid of plaque gently if you have it and prevents plaque from accumulating if you don't. So I don't like topical estradiol. I'll only use that in women who have a thrombophilia, which means tendency to form a blood clot. Testosterone, there's three delivery methods. I let my men and women choose. Progesterone is always a capsule or a troche. Creams are not enough to protect the breast, the uterus, and the brain. And then thyroid. Thyroid's a tablet. We start low and we work up in all patients to see if it's something they're going to stay on. So that's most of the hormones that I do. I just don't like Biest. I don't like estriol. I don't like creams unless it's for testosterone, and I prefer oral estradiol due to the abundance of protection that you get compared to topical. Topical estradiol does treat hair, skin, nails, vagina, bones, where oral gets to the heart, oral gets to the brain.